This Spotlight on Long-Term Care is sponsored by Game Plan Financial. Every game has a winner, every winner has a game plan. For more information, visit gameplanfinancial.com. MetLife Incorporated announced last month that it will no longer sell new long-term care policies, citing financial challenges in the business. MetLife, the largest life insurer in the U.S., says it will continue to honor old contracts and will accept applications for new long-term care coverage through December 30th. Insurers offering long-term care are facing the challenges of higher number of claims, higher cost of care, and increased life expectancy of their policyholders. According to Vice President Jody Anatoli, quote, "While this is a difficult decision, the financial challenges facing the long-term care industry in the current environment are well known," unquote. The Kaiser Family Foundation reports more than 10 million Americans are in need of long-term care services in the U.S., and the number is projected to increase. One quarter of long-term care insurance buyers during the first half of 2009 who were age 60 and under paid less than $1,000 per year for their coverage, according to an American Association for Long-Term Care Insurance report. The report found that 28.9% of LTC policyholders under age 61 pay between $1,500 and $2,500 per year in premiums. Less than 1/10 of LTC buyers in this age group pay $4,000 or more. Costs for LTC coverage can vary widely and depend on a number of factors, including age and health status. AALTCI found that of individuals who are between ages 61 and 75, 9% pay $1,000 or less when they apply for new LTC coverage. The average age for new individuals purchasing new LTC policies is 57, and 80.5% of new individual buyers in 2009 were under age 65. Two federal courts recently found that the U.S. Department of Health and Human Services, or HHS, was too strict in enforcing Medicare rules regarding individual coverage. In separate rulings, the courts found that older Americans are entitled to Medicare coverage of skilled nursing home care and home health care, even in cases where they are unable to verify that such care would improve their conditions. Skilled services are covered by Medicare for up to 60 days following hospitalization, in cases where care is required to help with routine activities of daily living, or to prevent the patient's condition from deteriorating. The U.S. District Court of Pittsburgh upheld the appeal of a patient regarding an HHS administrative judge's denial of Medicare coverage in a case where the patient asked for skilled nursing services to help her walk following a series of issues related to a hip replacement surgery. The court overruled the HHS, finding that the law enacting Medicare must be, quote, liberally construed in favor of beneficiaries, unquote. In addition, Medicare must cover services that maintain a patient's current level of functioning, even in cases where no improvements are observed. In the other ruling, the U.S. District Court in Burlington, Vermont, overruled an HHS decision concerning a patient who applied for coverage for home health services after suffering a stroke that left her incontinent, cognitively impaired, and partially immobile, in addition to other ailments. The plaintiff was denied coverage for remaining treatments after 60 days of therapy, despite a physician's decision that the treatments were necessary. However, an administrative judge for HHS found that the treatments were not likely to improve the patient's condition. The district court reversed the decision on the grounds that it was not supported by substantial evidence. The ruling said that Medicare was responsible for the cost of services that prevented a worsening of the person's condition, not just services to improve a condition. For more industry spotlights, visit producersweb.com.